We often talk about addiction in terms of its effects on the brain, the cravings, the withdrawal, the hijacked reward system. And that's important. But addiction doesn't stop at your brain. It reaches into every organ in your body, including the very system that protects you from infection. When you think of someone with a substance use disorder, you might not immediately think of pneumonia, sepsis, or slow-healing wounds. But those conditions are common in addiction, and the link isn't accidental. Alcohol, opioids, stimulants, nicotine, and cannabis all have measurable effects on your immune system. Some suppress your defenses, making you more vulnerable to infection. Others trigger chronic inflammation, damaging your tissues over time. And many do both. Welcome to Health Sketchpad. I'm Dr. AB. Today, we're exploring the hidden toll of addiction, the impact of drugs and alcohol on your body's immune system. This isn't about judgment, it's about understanding the full picture of how substances affect human health. Because whether you're struggling yourself, know someone who is, or just want to understand the science, this knowledge matters. Before we dive into how substances affect immunity, let's do a quick refresher on how your immune system works. Your immune system has multiple layers. The first layer is physical and chemical barriers. Your skin, mucous membranes, stomach acid, and tears keep most invaders out before they ever get inside. The second layer is your innate immune system. This includes cells like macrophages and neutrophils, the rapid responders that attack anything foreign, but without specificity. They're fast, but they don't remember. The third layer is your adaptive immune system. This includes B cells, which produce antibodies, and T cells, which destroy infected cells. This system is slower to activate, but creates specific, long-lasting memory. These layers work together. When one layer is compromised, the others try to compensate. But when substances suppress or dysregulate these layers across the board, your body becomes vulnerable in ways you might not expect. Now let's look at how specific substances affect each of these layers. Let's start with the most widely used substance in the world, alcohol. Alcohol is an immunosuppressant. It affects your immune system at multiple levels, which is why heavy drinkers are more susceptible to infections like pneumonia, tuberculosis, and sepsis. First, alcohol damages your physical barriers. In your lungs, tiny hair-like structures called cilia constantly sweep mucus and trapped pathogens out of your airways. Alcohol paralyzes these cilia. They stop moving. Pathogens that would normally be cleared out can now settle in and cause infection. Second, alcohol damages your gut barrier. Your gut lining is designed to keep bacteria and toxins inside your intestines. Alcohol makes this lining leaky. Bacteria and bacterial products called lipopolysaccharides, LPS, escape into your bloodstream, triggering systemic inflammation. Third, alcohol suppresses your immune cells. Chronic alcohol use reduces the number of macrophages and neutrophils available to fight infection. It also impairs their ability to engulf and destroy pathogens. Your rapid response team is smaller and less effective. Fourth, alcohol disrupts your adaptive immunity. It reduces the production of B cells and antibodies, making vaccines less effective. Heavy drinkers have weaker responses to flu vaccines, pneumonia vaccines, and hepatitis vaccines. And here's the cruel irony. Many people drink to relax or escape stress. But alcohol-induced inflammation actually increases stress hormones like cortisol, which further suppresses immunity. It's a vicious cycle.
Opioids,
including prescription painkillers like oxycodone and illicit drugs like heroin, have powerful effects on the immune system that many people don't know about. Here's the mechanism. Your immune cells have the same receptors that opioids bind to in your brain. They're called mu-opioid receptors. When opioids bind to these receptors on your immune cells, they directly suppress immune function. The result is reduced production of cytokines, the signaling molecules that coordinate immune responses. Without proper cytokine signaling, your body takes longer to recognize and respond to infections. People who use opioids chronically have higher rates of pneumonia, tuberculosis, and skin and soft tissue infections. But the most dramatic example is endocarditis, an infection of the heart valves. Injecting opioids introduces bacteria directly into the bloodstream. When combined with a suppressed immune system, those bacteria can settle on heart valves, causing life-threatening infections that require weeks of intravenous antibiotics and sometimes heart surgery. Needle sharing adds another layer of risk, transmitting HIV and hepatitis C, both of which further devastate the immune system. The respiratory depression caused by opioids also increases pneumonia risk. When breathing is slowed, secretions pool in the lungs, creating an ideal environment for bacteria to grow. Stimulants like cocaine and methamphetamine affect immunity differently than alcohol or opioids. Rather than suppressing immune function, they often trigger excessive inflammation and tissue damage. Cocaine and methamphetamine cause your body to release massive amounts of dopamine and norepinephrine. These neurotransmitters don't just affect your brain, they also signal your immune cells. The result is a hyperinflammatory state. Methamphetamine use is associated with elevated levels of inflammatory cytokines throughout the body. This chronic inflammation damages blood vessels, organs, and tissues over time. The behavioral effects of stimulants also increase infection risk. Methamphetamine use often leads to prolonged sleep deprivation, which we know suppresses immune function. It also causes skin picking and poor hygiene, leading to skin and soft tissue infections. And like opioids, injection use transmits HIV and hepatitis C. Cocaine use has been linked to a specific condition called crack lung, a form of lung injury and inflammation that can cause fever, difficulty breathing, and coughing up blood. Chronic cocaine use also damages the nasal septum, the cartilage between your nostrils, when snorted, creating a direct entry point for bacteria into the bloodstream. The combination of inflammation and damaged barriers makes stimulant users vulnerable to a wide range of infections. Nicotine, whether from cigarettes, vaping, or smokeless tobacco, is often overlooked as an immune disruptor, but its effects are significant. Cigarette smoke contains thousands of chemicals, many of which are directly toxic to immune cells. But nicotine itself also suppresses immune function. Chronic nicotine exposure reduces the activity of neutrophils, macrophages, and natural killer cells. Your rapid responders are slower to arrive at infection sites and less effective at destroying pathogens. This is why smokers have higher rates of respiratory infections, including pneumonia, bronchitis, and influenza. Smokers also have more severe outcomes from COVID-19. Nicotine also impairs wound healing. Smokers have higher rates of surgical wound infections, slower healing of fractures, and more complications after surgery. The immune cells that normally clean debris and fight infection in wounds simply don't work as well. Vaping, while often marketed as safer than cigarettes, still delivers nicotine and other chemicals that suppress immune cells in the lungs. Early research suggests that vaping impairs the function of alveolar macrophages, the immune cells that patrol your air sacs and clear out pathogens and debris. Cannabis presents a more complicated picture than other substances. The active compounds in cannabis, THC and CBD, bind to cannabinoid receptors. These receptors are found throughout your immune system, suggesting that cannabinoids play a natural role in immune regulation. In laboratory studies, THC has been shown to suppress certain immune functions, including the activity of T cells and the production of inflammatory cytokines. This has led to interest in cannabis as a potential treatment for autoimmune and inflammatory conditions. However, immune suppression is not necessarily beneficial. It could increase susceptibility to infections. Chronic heavy cannabis use has been associated with higher rates of respiratory infections, bronchitis, and possibly pneumonia, though separating the effects of cannabis from the effects of smoking is challenging. Speaking of smoking any substance, cannabis, tobacco, or anything else, damages the cilia in your lungs and impairs the function of alveolar macrophages. The method of use matters as much as the substance itself. The bottom line is that we need more research. Cannabis is not harmless to the immune system, but its effects are more nuanced than alcohol, opioids, or stimulants. Direct immune suppression isn't the only way substances harm your defenses. Addiction also damages immunity indirectly through sleep, nutrition, stress, and co-occurring illnesses. First, sleep. Many substances disrupt sleep architecture. Alcohol may help you fall asleep, but fragments your sleep later in the night. Stimulants cause insomnia. Opioids can cause central sleep apnea. Chronic poor sleep suppresses immune function, reduces T-cell activity, and impairs vaccine response. Second, nutrition. Active addiction often leads to poor dietary intake, skipping meals, or eating low-nutrient foods. Alcohol provides empty calories while displacing nutritious food. Opioids can cause constipation and reduce appetite. Specific deficiencies are common. Thiamine deficiency in alcohol use disorder, vitamin D deficiency in many substance use disorders. Malnutrition directly impairs immune cell production and function. Third, chronic stress. Active addiction is a state of chronic physiological and psychological stress. Elevated cortisol, epinephrine, and norepinephrine suppress immune function over time. The stress of withdrawal, with its physical symptoms, cravings, and emotional turmoil, adds another layer of immune suppression. Fourth, co-occurring illnesses. Substance use disorders often co-occur with HIV, hepatitis B and C, tuberculosis, and other infections. These infections further weaken the immune system, creating a dangerous synergy. When you combine direct immune suppression with sleep deprivation, malnutrition, chronic stress, and co-occurring infections, the result is a profoundly vulnerable immune system. Now for the hopeful news. Many of the immune effects we've discussed are reversible. When someone stops using substances and enters recovery, their immune system can begin to heal. For alcohol, studies show that immune function begins to improve within weeks to months of abstinence. Lung cilia recover, allowing the lungs to clear pathogens more effectively. Gut barrier function improves, reducing systemic inflammation. White blood cell counts normalize. For opioids, immune function improves with sustained abstinence. The direct suppressive effects on immune cells reverse, and infection risk decreases. though the long-term effects of injection-related damage, like scarring of veins or heart valve damage, may persist. For nicotine, lung function improves after quitting, and cilia begin to recover within weeks. However, some lung damage may be permanent, especially after years of smoking. For stimulants, inflammation decreases with abstinence. The immune system gradually returns to baseline, though some organ damage may be permanent. For cannabis, many immune effects appear to reverse with sustained abstinence, though more research is needed. Here's the most important takeaway. Recovery isn't just about your brain, it's about your entire body. Every day without substances is a day your immune system has to repair, rebuild, and strengthen. If you're struggling with substance use, know that your immune system is waiting for you. It wants to heal. And with support, time, and treatment, it can. Let's bring this all together. Addiction isn't just a brain disease, it's a whole body disease, and the immune system is one of the most affected systems. Alcohol suppresses immunity at multiple levels, damaging lung cilia, creating leaky gut, reducing white blood cells, and impairing vaccine response. Opioids bind directly to immune cells, suppressing cytokine production and slowing pathogen clearance, while injection use adds risks of HIV and hepatitis C. Stimulants trigger excessive inflammation, damage tissues, and increase infection risk through behavioral effects like skin picking and sleep deprivation. Nicotine quietly weakens immune response and slows wound healing, while smoking any substance damages lung immunity. Cannabis presents a complicated picture, with both immune suppression and anti-inflammatory effects, but smoking it still harms the lungs. And indirect effects, sleep deprivation, malnutrition, chronic stress, and co-occurring infections compound the damage. But here's the message I want you to leave with. Recovery heals. The immune system has remarkable regenerative capacity. With sustained abstinence, immune function improves. Lungs clear, barriers repair, cells regenerate. If you're struggling with substance use, you are not beyond help. Your body wants to heal. Your immune system is waiting for you. If you know someone who is struggling, approach them with compassion, not judgment. Addiction is a medical condition, not a moral failing. And if you're here just for the science, thank you for learning. Understanding these connections helps reduce stigma and informs better prevention and treatment. Knowledge is the first step. Compassion is the next. Recovery is possible.